Hi everyone. Today I'll be discussing autism spectrum disorder. So for today's agenda, we will be discussing what is autism spectrum disorder, also known as ASD, diagnostic criteria, severity levels for autism spectrum disorder, some child development facts, and some strategies to help support teachers. First, what is autism spectrum disorder? Autism spectrum disorder is characterized by persistent deficiency in social communication and social interactions across multiple contexts, including deficiency in social reciprocity, nonverbal communicative behaviors used for social interactions, and skills in developing, maintaining, and understanding relationships. It is important to understand that ASD is a spectrum, meaning individuals experience a wide range of challenges and strengths. No two individuals with ASD are exactly alike. Next, we'll be discussing autism spectrum disorder diagnostic criteria in accordance with DSM-5. First, we'll be starting off with persistent deficiency in social communication and social interaction across multiple contexts. This might involve difficulty with back and forth conversations, nonverbal communication, or a little bit trouble developing relationships. I have experience working with individuals on the spectrum, and some things I have witnessed in regards to this is some children having a little bit more trouble making friends, and some challenges that I see is child having a little bit more trouble with understanding other people's emotions or having a little bit more trouble initiating conversation in the first place. Um, so some aspects would be them having a one-on-one to help support them with making these initial contact. Next, I'll be discussing restricted repetitive patterns of behaviors, interests, or activities as manifested by at least two of the following currently or by history. There are four aspects to this, but for someone to qualify to have ASD, they will need to have two out of the four. So, some examples of this include repetitive movements, intense interest, or needing things to be the same. So, some examples of this I could say is a child needing to line up their toys, flipping objects, needing to consistently move their hands. Um, Another thing could be a child having difficulty with transitions, rigid thinking patterns, so things need to be their way or the highway, there's no other way. They could take into consideration other people's thoughts and needing to stay consistent with their agenda, with their plan for the day. Another aspect is an individual being highly fixated on their interest. So they have like a really strong attachment to books or the park or the library. Like they need to be consistently engaging in their interests, and it's very hard to have them interested in their least preferred interest. Another aspect is hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. Some examples I have seen in my work experience is some of my kids have sensory to noises or are sensitive to noises. So they when they hear like an ambulance come, they cover their ears and they're screaming like it needs to stop. Or some kids crave the emotion or crave the noises. So they like me playing Cocomelon during sessions, or they like when I'm clapping. They need that to be able to help regulate themselves. Another aspect that I have seen is kids engaging in water play, like they need their hands um, to be touching items for them to be able to help self-regulate. There's other examples, but those were the examples I could think of offhand. C, we're going to be discussing symptoms must be present early developmental period, though they may become noticeable as demands increase. D, symptoms cause significant impairment in their social, occupational, or other important areas of functioning. And then E, these symptoms are not better explained by other conditions like intellectual disability or developmental delays. There are three levels for autism spectrum disorder, or three severity levels of autism spectrum disorder. And first, we're going to be discussing level 3, which is requiring very substantial support. This is the highest level support an individual may receive. This level includes individuals with severe difficulties in communication and inflexible behaviors who need intensive support to navigate their daily routines. In most cases, these students have one-on-ones with them at school. They have that extra support to be able to manage their day. Sometimes they even have extra support in the home or need a parent with them at all times when they're at home because they need that hand over hand connection with individuals. Level 2 is requiring substantial support. So that's when an individual is kind of like in the middle ground. At this level, individuals often have more pronounced social and behavioral challenges, requiring significant help in their daily life. So with this, they'll have more behavioral challenges, but um, they could have a little bit of support with navigating this. So in this case, maybe a student will have a behavioral tech with them at school, someone to help them navigate their if they have any behavioral challenges. Or they might be receiving ABA to help reinforce positive behaviors, replacing the negative ones. These are some tools and resources that could help individuals that need that support in the classroom or in the home environment. And then level 1 is just requiring support. So this is the least amount of support that an individual in the spectrum will need. Individuals that need the support may struggle with social interactions, have difficulty switching between activities, but can function with minimal assistance. I have seen this in my practicum. Some of the kids that are more high functioning and just need that extra eye on them, my school psych will go check on them during class and pull them out for like 5 minutes, see how they're doing, see if they have any challenges that they need extra support. And if they don't, we'll end it there. But if they're like, oh, like there's this student that I feel like is not getting along with me, we'll help them navigate that situation and be like, oh, you're having a little bit of trouble during recess. We'll meet you at recess and help you navigate that. So this one is just the least amount of support, but they still have it just in case they need it. I did also want to provide some developmental facts. I believe this is important to keep in mind when diagnosing someone with ASD, that the symptoms are typically recognized during the second year of life, between 12 to 24 months. Some symptoms can be shown in earlier ages. I know I have witnessed it where we have seen some families have challenges at early, so sometimes we do refer them to SCLARC, which is a regional center, and they'll receive services for the first 2 years. And then if they do end up qualifying for under the ASD, they'll have continued services. But if not, they'll be graduated from the program. Some other developmental facts. First symptoms of ASD frequently involve delayed language development. So a child might be nonverbal or have a little bit more challenges with communication. I have witnessed in my practicum that some students are receiving speech and language or meeting with the speech pathologist, and then when the behavior or not when the language challenges become a little bit more severe than what the speech pathologist can help with, then we'll connect them to the school psychologist and have them reassessed for a psychoeducational report. Some other things that we see is a lack of social interest or unusual social interactions. So some examples of this is pulling individuals by the hand without any attempt to look at them, carrying toys around but never playing with them, and then unusual communication patterns such as knowing the alphabet but not responding to their own name. During the second year, auto repetitive behaviors become more apparent, like watching the same video a couple times. But as a clinician, we'll be able to distinguish the type, frequency, intensity of the behavior to help diagnose an individual with ASD. Lastly, I did want to provide some strategies to support students with ASD. As a future school psychologist, I think it's important for us to collaborate with teachers for them to be able to have that extra support in the classroom. I know we're moving towards more of a general ed and special ed together. So I want to just be able to help support with that transition as much as possible. So one strategy I have seen is limiting sensory overload, like limiting shouting, loud noises in the classroom, limiting blinking lights because some kids are sensitive to lights, providing sensory materials to support with regulations such as Play-Doh or kinetic sand. With this, we could utilize the school budget, or we could talk to parents, see if we could have any resources brought to the school to be able to help them with self-regulation. I think it's important to first communicate with the parents, see what some strategies that they use in their home, and we could hopefully incorporate that into the classroom if it is needed. Strategy two, visual schedules with daily routines. I've seen in special ed classrooms that the teachers have charts with like everything they're going to do in the day with the picture. And I think that helps provide structure for the kids and have consistency and help with those transitions that happen. Because if you think about it, there's so many transitions that happen in a day when a kid is when a kid is at school. And for a child that is on the spectrum, that's a challenge that them going through all these different transitions. So I think us helping prepare them with the visual guide will help with the transitions just a little bit more. And then strategy number three, using concrete, simple language. Children with ASD tend to struggle with abstract language. So being able to communicate what you want in as simple language will be able to help them hopefully complete the task and could help support them. Another way you could help support them is breaking the task to small, manageable tasks, and that will help with completion of assignments. Overall, like I said in the beginning, ASD looks different in everyone. So these are just a few strategies that could help with an individual, or we might need to go to the drawing board and come up with some other interventions that could help support. But I did want to provide a little bit of strategies that could hopefully help my future teachers. And lastly, here's some references that I used. I used the DSM-5 and also used National University and the Incredible Years website for some strategies to help support teachers. Thank you for listening to my presentation.